local doctors and talk to some of the issues around some of the broad cuts that are coming through. So thank you for coming out tonight, and thank you for my staff and the staff of Shadow Cornwall for allowing us to use this facility and for setting it up. So I'm going to turn it over to Dr. Foley, who's graciously agreed to look after tonight and lead the forum. So thanks very much.
Good evening, folks. Thank you all very much for coming out. How's the sound? Can you hear me okay? No. A lot of it. That's unusual for me. Sorry. I'm a local general practitioner here. And, my name is Gareth Foley. I'm a local GP and I've been in Cornwall now since 1985. I represent the local Cornwall Academy of Medicine as the president, and I'm also involved in the section the GPs of our team. When I first came in 1977, it was commonly amongst all my colleagues that this was the best healthcare system in the world, and I saw that for a fact that it was. 30 years later, I cannot say the same thing. I have to say that we are living in dire times. What hurts me as a doctor is to see the utter degradation of a wonderful system. The way it hurts is the gradual but piecemeal destruction of what used to be. From everything from waiting lists to lack of supply of machines. In 1980 I saw the first MRI scan set up in a hospital in London, Ontario, St. Thomas. Here we are 30 years later and we still haven't got an MRI scan, although I must admit it is common. We just don't know now. So the shocking thing that came out of our negotiations with the Ministry of Health was the lack of negotiations. We've been used for, certainly I've seen it for the last 10 years when we deal with the government. It's a form of co-management amongst those, the providers of the care and those who set up the system. It's a very mutual respect and mutual information. When they come to us with a plan to change the fees in such and such a manner, we can point out to them quite rightly that if you do this, there's going to be unintended consequences. And as a rule, we sort of stick handle the medical problems for Ontario, other than the provision of money. We obviously have no control over that. But we do try to point out ways that if you do this, this will be a disaster, because we're experts. We know what's needed in our particular area and our particular field. That's why I have colleagues of different specialties here tonight. So what I'd like to do is just say my biggest shock as a member of political medicine is the utter shutdown of negotiations. Not even negotiations have occurred. There's a thing called mutual respect, where you deal in good faith, and that has disappeared to the point where the Ontario Medical Association, which is recognised for over 50 years as the leaders, the speaker for the doctors, in effect a union, even though we're not formally a union. And our government has ignored us, insulted us, literally name calling, which you don't expect from somebody of that stature. And what has happened is that we're left in a state of unbelievable shock at the stupidity of what is occurring. What people don't realise is that it's not just going to affect doctors and their income, it is going to affect the services that we provide. I think I've said enough for the moment. I think I'll pass on to my colleague. Ron, have you anything to add? So for radiology, we have... Okay, ladies first.
First of all, I really would like to thank Jim McDonell for inviting us here to give the doctors in Cornwall an opportunity to discuss our concerns regarding the impact of the healthcare cuts, the actual unilateral legislated healthcare cuts by the McGuinty's Liberal government. There was absolutely no negotiation whatsoever, and that's what each one of you need to know. Personally, I don't think that's fair, that we are not allowed to be part of the discussion. So that's why I think it's important for us to have the opportunity to explain that to you. I am the Chief of Ophthalmology Service in Cornwall, at the Cornwall Community Hospital. And I am deeply concerned about how the cuts are already affecting the patients here in Cornwall. I mentioned before, I am disappointed with the arbitrary nature of the cuts and the lack of meaningful consultation with the doctors of Ontario. So, right now, we only have 2 full-time ophthalmologists in Cornwall. So what is an ophthalmologist? We are eye physicians and surgeons, okay? So we take care of all the medical and surgical eye needs here in Cornwall. And as a result of that, many of our patients have been saved travel to distant cities such as Ottawa and Montreal and Kingston and Toronto because of the excellent care we are able to provide here. Dr. Gaindo recently retired his surgical practice, so therefore he is no longer at the hospital providing emergency care. So that leaves both myself and Dr. Youssef to take care of this entire community. So, up till now, the 3 ophthalmologists, we have been able to provide on-call coverage 80% of the time. So that means the majority of the time, if you have an eye emergency, there was a doctor there to take care of you. That's not going to happen anymore. And the reason is because of the cuts that have happened. We are no longer able to recruit a 3rd ophthalmologist in Cornwall. So what does that mean? That means that there will be less coverage for emergencies. I had a patient today that I saw. I told him all my patients make him smile usually, but he particularly does. And I was on call one night, and an optometrist, who is an eye doctor as well, but doesn't do surgical treatments, and they don't do medical treatments, or they just recently were able to. Anyhow, he saw this patient who lost the vision completely in one of his eyes. He called me up and told me that he had this patient who lost his vision, and he felt it was this condition that if I were able to see the patient right away, I could save his vision. So he sent the patient to me. Unfortunately, I was about to leave. I was on my way to go home and cook dinner for my family. But I stayed behind, and I saw the patient, and I actually saved his vision. Okay? I can't do that 365 days a year. I need a 3rd ophthalmologist here to take call for those patients. What is going to happen? It's already happening now. Patients need to travel to Ottawa to be seen. How many of you rely on your family members or friends to bring you to your doctor's appointments? Many of you. Exactly. There's a tremendous amount. And you feel bad that you have to be brought to these appointments for your family. We're able to provide care here in Cornwall, and we're proud of that. And that is being degraded by these cuts. You will have to wait longer to see an eye surgeon. It's going to take longer because if we do the math, there's only 2 of us now to be able to do all the surgery in Cornwall. And some of you may choose you don't want to wait, and I don't blame you, so you're going to travel. Some of you have that option, but many of you don't. There will also be longer wait times for surgery. The reason there will be longer wait times for surgery, the obvious, there's only 2 of us, but secondly, there are also now cuts to the way that cataracts are being funded. The government has decided that they're paying too much for cataract surgery. So therefore, they are going to carve out money out of the hospital budget and give back money. They're giving back.
Do you understand what they're talking about?
It's 30% less to do those surgeries. The hospital has decided they are still going to provide that service at a lower cost. So we're very fortunate we're still going to be able to do those surgeries here in Cornwall. The issue is that there may come a time where they're not going to be able to afford it anymore, and that then they're going to have to cut somewhere, and it may be cataract surgery. The other reason you may end up waiting longer is because one of my colleagues does bilateral cataract surgery. So what do I mean by that? He does your two eyes at the same time. He's one of the few people in Ontario who do that, and he's way ahead of the curve when it comes to that, because most of us aren't ready for that yet. So therefore, there are some conveniences for people for that. With the current funding for cataract surgery, he's no longer going to be able to do that anymore. So the government is deciding the way doctors are practicing medicine. To me, that is simply wrong. I'm not even done yet. There are other things, and I won't take up much more time, but I really feel it's important to know. There is also decreased access to the diagnostic tests that we do for ophthalmology. So what do I mean by that? Well, if you have macular degeneration, how many here have macular degeneration? Who have glaucoma, who have cataracts, all of the tests for those procedures have been cut. They have been cut so much that some doctors are no longer able to offer those tests in their office. You are lucky here in Cornwall because all three of us have decided we are still going to continue to offer those tests to our patients at a loss. We are not making any money off the tests. We never really were, but the government thought for some reason we were making too much money, okay? So therefore, we are no longer able to provide certain services. I had to cut my staff hours down because I have to find ways to be able to still provide the tests. So people will have to wait longer for those tests. The other thing they've done is, for those of you who are being treated for macular degeneration, you get injections in your eye. Every time you get an injection, it is necessary for the doctor to do an image study, okay? Because he needs to know if that injection is necessary or not. Because who wants a needle in their eye if they don't need it? I certainly wouldn't. What they've decided is that normally this could mean you need that test up to 12 times a year, so once a month. Up till now, the government has been paying 6 times a year. They've now, and so 6 times the doctors were doing it for free, just so you know. Now, they're only funding it 4 times a year. So, do you think the doctors aren't going to do the test? No, we care about our patients. We want you to get that service. So we're going to continue to provide it, but we're not going to get services to be able to continue to provide that. So the doctors then started buying the equipment in their own offices. And this became a standard of care, because then patients can get the testing done in the office by the same doctor who's going to read it, and therefore be able to prescribe the correct treatment or no treatment. The Ontario Liberal government has decided that doctors who do tests in their office are being greedy, that we're doing a bunch of unnecessary tests, so therefore they're going to cut us by 50% on doing those tests. But like I said, at least here in Cornwall, we're still going to be providing it. I have colleagues I know who rent the machine, and they've not been able to rent it anymore because they lose money every time, so they said, we can't do that. So they have to send the patients elsewhere, and they're having to travel. I'm very concerned about the way the cuts were made, and without discussing this with the doctors of Ontario. I know that the eye physicians and surgeons of Ontario, here in Cornwall and across Ontario, are committed to providing the best care. That's what we're here for. We understand the current fiscal reality, and we understand the need to balance the budget.
Okay, thank you.
We have already contributed significant savings to the Ontario government, and would agree, we have already agreed to voluntary reductions to the top 3 codes that we received payment for. This has resulted in significant savings for the government. We want to contribute more ideas, but only through the OMA and with a conciliator, as we feel the government has lost the trust of the doctors of Ontario. If you have concerns about this, I know Mr. McDonell has already heard from many of you, and therefore that's why he's decided to put together this town hall. If you go on the internet, you can go on to supportontariodoctors.com. You can also write to Dalton McGuinty and Minister Dan Matthews regarding your concerns. I also, for anybody who's interested, I do have a patient advocacy kit. Gives you information about the cuts if you want more information, and gives the contact information for Dalton McGuinty and Dan Matthews. Thank you.
Well, thank you very much. I'm Tom Bates, and thank you very much, Mr. McDonell, for organizing it. Mr. McDonnell's cousin was one of my greatest helps in Cornwall, setting up diabetes program. So thank you very much for the family, everybody else. I have been specializing in internal medicine, and I have practiced my specialty in Ontario for 45 years and 7 days. And I do intend to continue, despite the two negatives. One of the negatives, what Dr. Seuss referred to, is the government lack of respect, and the other is financial. I looked at the numbers. Over the years, had my income kept up with inflation rate, my income would be 23% higher than it is now. So we did have a reduction in our fee schedules over the years. The left-wing propaganda machine tries to make it out that we are over-bloated, money tossing around the billionaires. Make a mental note. How much is my overhead per day? Just make a mental note. It's $700. So $700 a day goes for salaries, telephone, rent, etc. So yes, I do have to make money. I actually work 75 hours a week when I'm past retirement age. And that is why Christine Blizzard and the rest of the left-wing idiots can easily say, oh, the doctors are making too much money. Yes, I do, because I work 75 hours a week. On the other hand, they also criticize that the doctors as a whole are overstepping the budgets. With Mr. McDonnell's office helping me out, the OHIP budget over the past 9 years during McGuinty government rose by 2.7% a year, which is very similar to what the overall government expenses were. So the OHIP budget did not increase any more than the government expenses in general did. We are not an overbloated bunch of money-hungry people who have nothing else in life except how to start money in our pocket. That's absolutely baloney. Now, I also want to mention that we are, as Dr. Seuss mentioned, under increasing government control in every respect. Not only our fee schedule, it's only taxi drivers and physicians who have a fee schedule. Nobody else does. Only taxi drivers and doctors. What other profession or what other employment can you think of where there is a government imposed, whether it's municipal or provincial or federal government? What other area can you think of where there is a government imposed fee schedule? Can you think of any? I can't. And that comes after 13 years of education following my 12 years of high school. So I am really under a very severe government dominance, not only what I can learn, but how I can practice medicine, what I am allowed and what I am not allowed to do. This degree of government control is only in 2 countries in the world, North Korea and Canada. There is no other country in the world which has the degree of control over the medical profession. Yet the left-wing propaganda constantly tries to promote that we physicians are the bad people. Medicare in Canada works because of the medical profession. We are the ones who keep Medicare going, not the political system. If the political system would be honest, it would admit that no country in the world can do everything for everyone. During a cruise a year and a half ago, my wife and I sat at a table with 2 American couples. One of them was a high-ranking minister in the agriculture department, and he is planning to run this fall for congressional election as a strong Obama supporter. So we did talk a fair amount of health care, and we both agreed that no country in the world can do everything for everyone. We are trying. That's why Dr. Seuss works at hard. That's why I work 75 hours a week. We are trying. But are we getting credit for it? Neither from the government nor from the left-wing media. Now, I'm sure that some of you are aware dictatorships exist and so on. I have lived under both Hitler and Stalin. I do know what dictatorship is. And we, the medical profession, are getting closer and closer and closer to a total control by Lynn, the government, etc. Now, I'm also fully aware that there may be some people here who are using the opportunity purely to tell hierarchy, you know, how we badmouth the government, etc., etc. I do want to tell you that when I went to high school, during communism, we were allowed to have religion class, and the last class, one of the people who was into religion classes came in his secret service uniform. So I have a very high respect for people who are subterfuging and are using any opportunity to talk in a negative way. But I'm very honest about my worry. When I was in Hamilton before I came here, a very wise physician told me, Tom, these are the good old days. And they were the good old days when we could help people without constantly having our hands tied as to what you are allowed to do, what you can't do. We, the medical profession, are holding up the system, and all that we get from the left-wing propaganda machine and the left-wing government is a kick in the rear. And that is basically what we are objecting to, and that is why we are upset about us being treated unfairly. The Catholic teachers agreed to a pay freeze. The OMA agreed to a freeze of the fee schedule. The government wants to cut us by about 16 to 20% in the next 4 years. That is what the government is planning to do by not freezing my income, but freezing the total budget for Ontario, despite population increase and increasing aging of the population. So that's what we are objecting to, being treated as servants instead of highly regarded professionals.
French or English?
I'm Dr. Cook. I'm Chief of Staff at the Cornwall Community Hospital. I'm here to speak to you today as the Chief of Anesthesia, which I've been for the last 6 years at the Cornwall Community Hospital.
Louder, please.
Sorry, okay, I'll make the best effort. I think it's important to put in, as you've heard already from many of the speakers already, there's a long history of the doctors through the OMA working with the government to try and find solutions for our healthcare in Ontario. And It is true, historically, anesthetists
don't even know.
Took you back 5 years ago. We actually made, that was one of the best paying lists, if you will, was cataract surgery, because it became so fast and so efficient. There's been so many advances in that particular surgery. But the OMA, through the anesthesia section, with the government, we actually worked with them to reduce those fees by 60% already. And that's the stories you don't hear from the government. So we do work with the government when we recognize that there's a problem with the funding, and we understand the government has fiscal restraints that it needs to be responsible as well. And we see that in the hospital constantly struggling with the budget to try and deliver the same service with less and less money every year. But we do work with the government to try and identify ways that we can address those concerns and still provide the best care for our patients in this province. That's what was completely derailed recently, when the government decided to unilaterally impose some of their changes to the fee schedule. One of the impacts that that's going to have, and is already having in the operating room at the Cornwall Community Hospital, is reduced access to anesthesia care for the eye surgery. They have cut those rates to a point where anesthetists, and I can't blame my colleagues, will go and find work doing elsewhere where they are properly remunerated, and that means that they are not in the eye room all the time. Now, we have worked as a department with Dr. Seuss to make sure there are lists where we can be available, but what this means is that on any given day, where you used to have an anesthetist probably 80% of the time, now you've got probably one list out of the month, which means you've probably got it about 20% of the time. Eye surgery is remarkable. Cataract surgery, anyone who's had it, it's on most days, I think it's less than a trip to the dentist. Most people would agree. It's fabulous, the technology now. And it can be done with just local anesthesia, but that works 90% of the time. It doesn't work all the time. And what the government fails to understand is that when it doesn't go well, when you're someone who is not comfortable, who is moving too much, and if you're working under a microscope and the person has a cough, or they get a little restless, or they have back pain and it's hard for them to lie flat, which are many of the patients do have challenges with, who's going to intervene and help get that patient as comfortable as possible, safely as possible? You have to realize that when you have cataract surgery, you're underneath drapes and you don't have access. So people are a little bit scared, understandably, to start using big amounts of sedation. And you have to get the right amount of sedation, because if it's too much, you get into la-la land, and then you can't cooperate with the surgery either, which is just as bad. So it's a bit of an art form to get the right amount of sedation so that Dr. Seuss and Dr. Youssef can do their surgery safely. Now, we don't have to intervene very often, but when we do, it's crucial that we do, because the eye is open and you're halfway through an operation. You cannot just sort of pack it up and go home and say, oh, we'll try this another day. Something has to be done. The problem in a small center like Cornwall, which if the government had bothered to talk to us about, we could have pointed out to them, is that we don't have the volumes to keep an anesthetist on float, doing nothing but available to intervene for emergencies. The bigger centers have the ability to have an anesthetist in the hospital who is doing rounds on chronic pain or acute pain patients, or doing obstetrical services, or just on salary to do nothing except intervene when needed. That's not the reality at Cornwall Hospital. There are 5 anesthetists on staff, and you can't have one of them doing obstetrics because there might just be one epidural that entire day. That's not the nature of how the system has been designed to be funded. And in Cornwall, it means that if you have a problem in the middle of the surgery, Dr. Seuss will have to do the best she can, and if she needs an anesthetist, now we're in the situation of saying, do I leave the patient that I have under a general anesthetic to go and help another patient? Or do I stay with the patient that I have under a general anesthetic? And Dr. Seuss has to do the best she can. These are tough decisions, and the government is putting us in the position to have to make these decisions now on a daily basis. And I don't think that's the best for either patient in that situation. When you're under general anesthetic, you don't want your anesthetist leaving the room to go and help someone else, you want his sole attention on you. And if you're the patient who's having their eye operated on, you want somebody who can intervene if something's not going well. So this is the kind of thing that the government is imposing through their fee structures. And if with consultation with the anesthetist, would have been easily able to understand that, and that's where it all broke down. I'd like to speak to one other issue as well, which in a small center, as Dr. Seuss has pointed out, recruitment can become a challenge. We have currently 5 anesthetists, which is a very stable number, and I'm quite proud to say that we haven't had to cancel surgeries because anesthetists have gone on vacation or been away for conferences because of that number. In the future, with these fee cuts, we're really going to have to reduce our numbers down to 4, because that's what the sustainable workload is now in Cornwall. And that's not just for what they've done with the OHIP, it's also a reality of what they're doing with their funding changes to the hospitals. And with a nice new OR, and we're not sure what kind of funding now they're going to be adding for that new OR, so we might have a beautiful brand new operating room, and we're really hopeful we can do the extra surgery that 6 months ago we'd already started negotiations with the government for, and now it's just all in limbo because the government's not sure what to do with that funding now. So if we bring the number down to 4 when someone goes on vacation, which we don't want to work 365 days a year, basically what ends up happening is that you have to close an operating room, so that just further reduces services and access to your health care. Finally, instead of talking about just anesthesia, I do chronic pain as well, and this area overlaps a little bit with the radiology issues, which I'm sure you'll hear more from Dr. Bublis about. But the government is, one of the things that has affected me as someone who provides chronic pain care for people with back pain. I do epidural steroid injections. To do that safely and to understand who's going to benefit from having a needle in their back, you need to have some x-rays, a CAT scan, possibly an MRI of your back to decide if your condition is the one that actually will benefit from an epidural steroid injection. The government has unilaterally decided that you cannot order a test for chronic back pain unless there's evidence to suggest that that will improve patient outcome. The first thing the government got wrong is no test improves patient outcome. It's what we do after we get the information from a test that allows us to improve patient outcome. So the other part is they did not define what criteria they were going to use to decide whether someone that you ordered the x-rays on was covered by OHIP or not. So this has led to a lot of, I think, fear about ordering these tests now, because the government will go to the family doctor, if I understand correctly, and remove the cost of that testing from the funding to the family doctor if the government decides that that test wasn't necessary. But they haven't told the family doctor what criteria they're judging when that test is necessary. If they said you can order this test under these certain conditions, it might have even made some sense. Or if they had said we're not paying for this test at all, so now you have the option to go out and pay for this test yourself if you think it's necessary. Either of those options would have allowed at least continuing care. At this point, many people can't get the test that would allow me to even decide if an epidural steroid injection would be helpful. And who wants a needle in their back for just sort of let's hope it works, without any clear evidence that that's something you really needed. So that's all I have to say. Thank you.